Generally, people know what a physician is. Generally, they think of all physicians as doctors who have an MD degree. However, there are physicians who hold a DO degree. So we're going to break it down today so that you have a better understanding of the difference between both and how these are two paths that can get you equally to become a physician. MD, or Doctor of Medicine, is the degree and title you attain when you complete traditional medical school. The traditional medical school teaches allopathic medicine, which is a medical philosophy of learning how to diagnose and treat human diseases. This is often referred to as conventional or Western medicine. DO, or Doctor of Osteopathic Medicine, is the degree and title you attain when you complete osteopathic medical school. Osteopathic medicine has a holistic philosophy that also uses hands-on manipulation techniques on the musculoskeletal system, in addition to modern medicine. So what are the similarities? Well, both require 4 years of medical education, whether you go to the traditional medical school or osteopathic school. Both require you to complete a residency after medical school to practice. And most residencies, as Dr. Marina mentioned, they accept both MD and DO students. Both are licensed to practice full scope of medicine anywhere in the United States. And then although osteopathic medicine emphasizes primary care, they can equally apply to any specialty to practice medicine, just like an MD. Pre-med requirements are overall also the same. For allopathic or MD schools, there may be just additional requirements with students required to take upper division science courses. But overall, both do require you to take the MCAT. So sorry, there's no way of getting away from the MCAT. The cost of going to MD or D school can also vary. So most of the DO programs are in private universities as compared to MD programs that have many programs in public universities. And as all of you know, and you've heard on our previous episodes, private universities are more expensive. This, therefore, then translates into DO students possibly coming out with more debt. From a quick search I did, it appeared that the average debt when you compare ND or DO, a DO will probably come out with $60,000 more in debt compared to an MD student. However, this is a very rough estimate because there's so many variables. For example, there are DO schools that are in a public university, so then that would offset, the difference as well. Or if you go to an MD school that is a private university, because those are going to be much more expensive. And then the other thing is whether you get grants, scholarships, or if you, depending on the cost of living or where the medical school is. So again, this is a big variable too.